Good morning. My name is Martin Luther Neugwou. I'm a student practical nurse. In this video is about the pouching colostomy. So for this I have the doctor's order and the MA. The MA I will just use the MA to identify my patient for patient identification. So the doctor's order is for Mr. Stevenson Rogers. Date of birth February 2nd, 1950. Patient ID 4324. On the MA is Stevenson Rogers. Date of birth February 2nd, 1950. Patient ID 4324. The doctor's order reads ostomy care daily and PRN, so as needed. Change ostomy appliance PRN, so change ostomy appliance as needed. So now I'm gonna go ahead and visit my patient. With my mask. So I'll provide hand hygiene, provide privacy. Good morning. My name is Martin. I'm a student practical nurse, and I'm gonna take care of you today. How are you today? May I have your name and date of birth, please? Stevenson Rogers, February 2nd, 1950. That's what I have on my MA, and I will check also the wristband. Stevenson Rogers, February 2nd, 1950, and Stevenson Rogers, February 2nd, 1950. So the reason why I came here is to administer is for colostomy care. So um, you had 8 days ago you had an operation for colostomy, and we are going to change the existing pouch and replace that with a new one. Do you have any allergy, please? No, no allergy. I can see that you are experiencing a burning pain at the ostomy site, rated at 6 out of 10. That's what the assessment uh, just uh, just the result of the assessment. Um, but I also see that you've been prescribed as needed Tylenol. So hopefully the Tylenol that you took about 10-15 minutes ago will kick in about 10-15 minutes, and it will reduce the pain. I see that your blood pressure is also elevated, so it's also high at 140/95. Um, I will talk to the doctor, and I'm sure the doctor will prescribe something to be taken so that you can lower and at least control your blood pressure. So what I'm going to do now, so I'm going to replace the pouch. So it's a procedure that in the future you might be able to do yourself. So if you allow me to do that now, so you have to right to refuse, but um, it's a good thing to always get rid of the bag of um, the waste that you have there. So I'm gonna go ahead and I'll put on my gloves, and I will observe. I will access the site first and remove the existing pouch. So for this purpose, I'll put you in semi-reclined position. Um, I will put my towel right in your lower abdomen area. So let me just expose quickly the area of your ostomy. So I see that you have about 200 milliliters of stool, and I see that the stool it's liquid. So I'll just go ahead and remove the stool. So I'll just remove the bag, and then I will remove the adhesive. So hopefully you don't feel any pain. No pain. Okay, that's good. So I'll just remove that, and I'll go discard that. But I'll go discard that, so I'll put a towel to just cover while I'm going to discard it. So I'm gonna go to the toilet and discard that, and also discard my gloves, hand sanitizer again, and I'm gonna wear new gloves. So I'm taking with new gloves. I'm back again. So I'm removing the towel, and I'm gonna observe the site for any swelling, any any swelling or any irritation. I can see that there is no swelling, and I'm cleaning now the around the ostomy side. When we clean and touch the stoma, it will be normal. It's normal that you will be bleeding. It's bleeding a little bit, but just a little bit. So now when I clean that, I will just dry it around. Um, I don't have the paste, but sometimes we might apply the stoma paste. Just it helps just to for adhesive, to make it more adhesive. So I have my pouch here, but before that, what I'm gonna do is I'm gonna use the template to measure the stoma, the diameter of the stoma. I can see that this this hole will fit, so I'm just gonna put that there. I see that it's perfect because the hole it's bigger than my stoma, than the stoma, and it should be at least 1/8 of an inch bigger, which is about 2-3 millimeters bigger. So I'm just gonna go ahead and use and cut 25 millimeters. So that's what I'm doing here. I have my pouch. I'm gonna go ahead and mark around, which is done here, and I'm gonna take my scissors and cut around. So, right there, cutting that around. Perfect. So not that perfect. If it's not perfect, I just correct it and cut it until I have it perfectly cut. So perfect. Once I'm finishing this, I'll remove the adhesive. I'll remove the thing that covers the adhesive, and I'm gonna apply that to my patient. I can see that it fits and that there is 1/8 of an inch, so that it won't irritate to avoid any irritation of the stoma. So once I have applied that, I can get my patient to put his hand a little bit around to, but generally speaking, the warmth of the abdomen will help uh, adhere. So once I'm done that, I'll take my pouch, and I will just apply on top right there. So just apply right there. So, and do not forget to put the clip. So I have a clip here, so I'll go get the clip. To clip the bottom. So I have my clip here. I'm just gonna go clip the bottom. I just put that on the table on the other side. So I'm clipping the bottom here. So once I've finished clipping the bottom, I'll cover my patient now. In some certain circumstances, you can give a mirror to your patient so that he can observe how you're doing that procedure. So I'll remove the towel now. Put my patient comfortably. So I will put the call light within reach and raise back the handrail. And now I'm gonna fill my documentation. So I'm gonna go ahead and fill my documentation. So I observed the stool chart. on March 10, 2021 at 1800. So the color of my stool was light brown, and it was watery, mainly watery, and the amount was 100 and I estimate the amount between 175 and 200 milliliters. So that's the stool chart, the stool chart. And then I will also document what I've done right away. So the nursing care record here uh, will read March 10, 2021 at 1800, and the nurse note will I'm just gonna write that I did change the ostomy, change the ostomy appliances, and then I'll write my name, Martin Luther Neugwou Wake Up, SPN. So this concludes the video about pouching colostomy. Thank you very much.